One of the other injuries that can occur with beginning exercise programs is a lot of hip injuries. Runners suffer from what's called snapping hip syndrome. What there is there's a large muscle that sits on the outside of your hip right over the head of your femur. Where your femur comes out of your hip, there's a muscle that sits right over the top of that called your tensor fasciae latae. That muscle is not very big, it's maybe the size of an open hand. But what it has is a long, thin band of tendon that runs down the lateral side of your leg and connects on to the outside of your kneecap right in through here. If this muscle is extremely tight, then that's going to pull up on that tendon and that's going to pull your kneecap out to the side. This can cause tension when you flex your knee into a running posture. If this muscle is really tight because of where it sits over the bony landmarks of your hip, it will actually cause that muscle to snap over the hip, which can bring on pain, which can bring on inflammation, which can bring on irritation. Any of these 4 injuries are problems that runners or beginning exercise folks will actually encounter quite frequently. All can be treated, all can be arrested before they ever turn into a more significant problem. If you should have a question or you should have an issue, call your local physician, check with a sports medicine physician, or try an athletic trainer.